everybody. Thank you for joining us. We are so excited to be talking about sleeping your way to a sharper brain, sleep, and different strategies for brain performance. I am Dr. Rachel Huser. I'm a naturopathic doctor.
I'm Dr. Amy Tarkini. I'm also a naturopathic doctor.
So, just to introduce us really quick, if you haven't seen us before, we're both practitioners here at Solcere. We're both RECODE certified, so we do use the Bredesen protocol to work with Alzheimer's, dementia patients, cognitive decline patients, and just overall brain health. And we both have a background in women's health, environmental health, and chronic illness. We're going to be talking a lot today about the link between sleep and dementia. But Dr. Tarkini, do you want to kind of give a background on what else we're going to be talking about today?
Yeah, so of course, we're going to talk about the link between sleep and dementia and cognitive decline, and sort of all of the subnotes underneath that, how sleep affects our emotional well-being, our immune health, our nervous system, and our hormone system. We'll talk about testing options and why it can be really important to test, especially if we suspect any reduced oxygenation at night, sleep apnea. We'll also talk about how to optimize sleep, what we as naturopathic doctors tend to call it sleep hygiene. And then we'll talk about, it's kind of a buzzword these days, REM sleep, deep sleep. We'll talk all about those different stages and how to get more deep sleep. And then also our favorite supplements for sleep at the end. And we'll have some time for Q&A as well.
Okay, so why do we care so much about sleep? I don't know about you guys, but when we talk to our patients, we're asking about sleep, for a good 5, 10 minutes. We want to know what time you go to bed at night, what time you wake up in the morning. We want to know if you're waking feeling rested or how many hours of sleep did you get? Did you fall asleep right away? Did you stay asleep through the night? So we really care about sleep because it's so important for cells regenerating, tissues growing, and muscles repairing. It's also, of course, important for cognitive function, like we'll get into throughout the rest of this lecture. But during sleep is when the brain really consolidates memories. It processes information from throughout the day and it starts to make these connections. So adequate sleep is really important for enhancing just basic skills like decision making, concentration, problem solving. It's also really important for emotional well-being. We find that sleep in general can affect mood and emotional stability. Chronic sleep deprivation is chronically linked to mood disorders like depression and anxiety. And then it has a big function within the immune system itself. Sleep supports the immune system in general by just allowing the body to have the strength to fight things off, infections and illnesses. But when there's insufficient sleep, it can really weaken the immune system and make people more susceptible. I mean, it's really common that you go through a period of no sleep if you're staying up too late or working too much, and then you can become ill after that. And then also with detoxification. So our brain itself has this lymphatic system, its own lymphatic system called the glymphatic system. And it clears neuronal toxic waste products during sleep. So think of that as kind of like the garbage truck that takes out the trash at night. If you don't have that, you're going to have all this trash accumulating. So it's really important that we get adequate sleep for the detox of our brain, which we know is important with cognitive health and all these things we're going to be chatting about when it comes to the brain. And then physical health. So there's a big relationship between chronic sleep deprivation and risks of conditions like obesity, diabetes, cardiovascular disease, and hypertension. So there's a huge chronic illness, chronic immune system imbalance link there, but then also just metabolic health in general.
Yeah, so specifically sleep and dementia. So like Dr. Husner just mentioned, sleep affects many aspects of our physiology, of our bodies, including our immune system, our metabolism, our emotional well-being, our hormones, or our endocrine system. So it's actually not surprising that both poor sleep quality and sleep duration are associated with neurodegenerative diseases such as Alzheimer's. And when we're thinking about a root cause approach to cognitive decline, we tend to think of these root causes as little buckets or different categories. So infections, nutrition, toxins, structure, so your airway, your stress, signaling, so like your hormones, vitamin D, which are all, as Dr. Husner just mentioned, largely affected by lack of sleep. Specifically, we also see neuronal loss. Neurons are the brain cells that we're talking about here in regions of the brain that are associated with Alzheimer's disease, such as the posterior cingulate cortex and the precuneus. And also, when you hear Alzheimer's talked about, you'll oftentimes hear it associated with something called beta amyloid plaque, which is basically a protein that can build up in your brain. And we see it in folks with Alzheimer's disease. And actually, just one night of poor sleep causes the ability of your brain, reduced clearance of your body to clear this protein. So we see amyloid plaque start to accumulate. And all of these factors, the kind of loss of our ability to repair and restore, causes this thing called neuroinflammation, which basically means that your brain it has a fire and it's having a hard time putting it out. It's having a hard time allocating resources appropriately to fight infections or to repair and incorporate new memories and things like that. And specifically, we see your hippocampus, which is a region of your brain that's crucial for memory and learning. We see that this is a piece of your brain that's particularly sensitive to the effects of sleep disruption. So there's a couple different ways that or poor sleep quality can predispose us to issues with cognitive impairment.
So sleep optimization, like Dr. Tarkini said, we love this word sleep hygiene. It's our way of listing out just basic foundational things that we can have our patients do for adequate sleep at night, for maintaining that nice, healthy environment for sleep. So one of the first things I talk about with my patients is creating a consistent sleep schedule and bedtime routine. So one, because the nervous system loves routines. We love our body kind of gets used to something to look forward to. We're similar to animals, right? We like that routine, and our system gets used to it. But we also want to facilitate those restful brain waves and tune into that parasympathetic for that rest and digest of our nervous system. Flip that switch over from the sympathetic to the parasympathetic. So when I talk with patients, I'm often, talking about this bedtime routine to calm them down, doing a yoga nidra or a meditation, some breath work, a nice warm bath or shower, but also knowing the flip side. It's not the time to be watching something really stressful. It's not the time to be putting on the news, getting really stressed out about what's going on, putting on a stressful movie or show. It's a time to really relax. So creating that sleep schedule with a consistent wake and sleep time, and then also some ways to wind down at night. Also getting some sunshine in the morning. So we talk a lot about the circadian rhythm. That is when cortisol, our stress hormone, is spiking in the morning. That's natural response. That's actually it's caused from light coming into our eyes, stimulating our cortisol to be released. And that's going to keep us awake and alert. And that will naturally fall throughout the day. And then at night, we have darkness coming in through the eyes, and that stimulates melatonin to be released, and that's going to facilitate sleep. And that should naturally then fall through the morning. So that is our circadian rhythm on a biological level. Sunshine in the morning actually will help us sleep at night and keep that rhythm on track. It also helps to regulate, we talked about melatonin, but also serotonin. So mood can also be played around with our morning sunshine. It energizes us and gets us happy. Making a comfortable sleep environment is also pretty important. We want it to be cool, dark, and quiet. So optimal temperature would probably be around 65 to 68 degrees Fahrenheit. Probably a little bit cooler than what most people would think. We don't want to be too hot. Dr. Tarkini taught me our nail trick to see if it's dark enough. So if you have your hand out in front of you and you can still see your fingernails and it's not dark enough. So often, like I said, that light that comes in through the eyes can stimulate cortisol to be released too early and then disrupt sleep. So getting blackout curtains, using an eye mask, removing electronics that might have some light, that'll be important to create that sleep environment. limiting exposure to screens. So going back to that circadian rhythm, we don't want to stimulate that cortisol at an irregular time. And even blue light tends to do that. So blue light from screens, that's going to disrupt our circadian rhythm. Trying to avoid that about 2 hours before bedtime. And same with caffeine. If we can try to avoid that, I like to say no later than 2 p.m. And then heavy meals about an hour to two before bedtime. Again, we're just trying to do our best to put our body into that rest and digest phase of the parasympathetic, not stimulate us, and then also not take too much energy away from calming down, which can go to digestion if you eat a nice big heavy meal. You do need to be careful though for some patients that have some blood sugar issues, that there might be a little bit of a blood sugar drop at night, which can disrupt sleep. So for some of my patients, if there is a roller coaster throughout the day, you also can have that going on at night with your blood sugar. We're talking about having a protein snack before bed, having some fat before bed, something to help keep that a little bit more stable. And that could look like some cottage cheese, a hard-boiled egg, maybe even just some pieces of cheese or some nut butter. I like to have, if I'm really hungry, a little bit of the grass-fed, what are they? Beef sticks. Those things are nice. They're high protein and they're just a quick little snack. Even just like a handful of nuts would be nice. And then getting to some of the issues that are underlying of insomnia and sleep dysregulation. So working on the adrenals, working on stress management, also addressing sleep apnea, probably one of the biggest things that we're going to highlight here. So reduced oxygenation at night to the brain is a risk factor for Alzheimer's, for dementia, and we want to do our best to negate that. So this can be a structural cause of dementia because, the airway is actually structurally not getting enough air in, but it can also really decrease just the oxygenation and the blood flow to the brain. So looking at that vascular level as well. We want your nighttime oxygenation levels to really be close to that of daytime. So you can even test that with an oxygen saturation, and we'll go into more of that when we talk about testing in particular. But that's one of the biggest things that we, right off the bat, we're asking our dementia patients, even patients with hypertension, there's a big link there with sleep apnea, and it can easily be fixed. Correct any underlying hormonal imbalance. So we want to correct imbalances of our sex hormones, specifically of estrogen, progesterone, testosterone. It's often that we see women in that perimenopause, menopausal, postmenopausal state really suffering with insomnia. And we just add a little bit of progesterone, especially oral progesterone, because that can cross the blood-brain barrier, go into the brain and help create GABA, which is our calming, more inhibitory neurotransmitter, and really promote relaxation and sleep. So that is one of the easiest things that we can do for our women patients, and then just helping with testosterone and estrogen as well.
Yeah, so one of the questions that we've been getting recently is how can I get better deep sleep, or how can I improve my REM sleep? And I think we're going to dive into that, but I think it's really important to start by saying that all stages of sleep are important and they work together. So if you've ever done a sleep test or you have one of those fancy little bio tracking devices, you can see that our sleep actually goes in a rhythm. And all stages of sleep are really important. So I'm going to talk specifically about REM sleep and deep sleep here, but know that when we're talking about optimizing sleep, we're really talking about having fully functional sleep cycles, really. So to start, REM sleep stands for rapid eye movement. This is the time when your body is consolidating. So we're really taking our procedural and our emotional memories and consolidating them together. We're also integrating new memories and existing knowledge. So by doing this, we facilitate learning. And then this REM sleep is also essential for brain plasticity, which I'm actually going to circle back to in just a moment. Deep sleep, also sometimes called slow wave sleep, because it's the time of sleep when our brain is actually moving through the slowest brainwave patterns, is also essential for memory consolidation. So this is when we transfer short-term memories into long-term memories. This is also when we do neurological restoration. So that's kind of a fancy term for cellular repair, growth, and consolidation. And then we also see slow wave sleep being beneficial for synaptic plasticity. And what your synapses are the little connections in between your brain cells. And we see that deep sleep helps us actually strengthen or weaken these synapses over time, which helps us promote learning and memory formation. And then some kind of like our top sleep strategies, because Dr. Husner just went through so many great ones. But when we're thinking about kind of overall ways to boost all stages of sleep, we're thinking about movement, regular exercise. And it's actually important. Sometimes exercise can be really stimulating for folks. So oftentimes we recommend, if that's the case for you, not doing it too close to bedtime. Doing it when you wake up or in the afternoon earlier in the day tends to help us not be so energized right before bed. Stress management is a huge one. So of course we talk about addressing underlying cause with any condition that we're treating. But oftentimes when we are dealing with insomnia or something like that, there's a big stress component. And so as Dr. Husner mentioned, typically before bed isn't the time to listen to a great crime podcast or do something that can feel a little bit stressful. We want to work on those restful brain waves, those rest and relaxation arm of the nervous system. And so I love meditation. I love deep breathing. Dr. H also just mentioned yoga nidra. That's another personal favorite of mine. And then another strategy, so avoiding alcohol and nicotine, especially before bed. I have a lot of people talk to me about how a glass of wine at night can help them fall asleep and help them wind down. And while it might feel like it helps you fall asleep initially, when you drink alcohol, it actually lowers your body temperature, and then that's only temporary, so it can go back up again, and then sometimes that increase wakes us up. So that disrupts that rhythm that we're talking about here, which is why in the morning, even though it might have felt like you fell asleep quicker, you probably won't feel like you're waking rested. Along with the stress management, it's important to have an environment that feels conducive to sleep. So I always tell people to make their bedroom really lovely and nourishing. You can get a candle. Blackout curtains are really lovely if you know that there's a lot of light coming into your room. I love to talk to people about non-toxic bedding that feels really comfortable and we're not getting any other exposures there. And also going to bed earlier. So research has actually demonstrated that the hours before midnight are actually the most restorative. So sometimes it might be that the duration of sleep is okay, but you're still not feeling totally rested when you wake up. And sometimes just shifting that a little bit earlier, going to bed at 9 or 9:30 or even 10, can actually help you with the same amount of hours feel a little bit more invigorated when you wake up.
Okay, testing. So it's important for testing, at least from our point of view, because number one, we want to rule out sleep apnea. Like I was saying before, it's a huge risk factor for Alzheimer's and dementia. You're decreasing the amount of oxygen that's getting to the brain. So the gold standard for any kind of sleep testing is still PSG or polysomnography, which is when you're going into some type of sleep laboratory or sleep center, if they're monitoring different parameters such as your brain waves, eye movements, muscle activities, your heart rhythm, breathing patterns, oxygen levels, of course, and they can even look at your limb movement. So that one is the most intense one, obviously, but that is the gold standard because you're getting a lot of information from that. But we can use some new advancements in technology for at-home testing. They're more affordable, they're way more convenient for a lot of people. So these are great options for people if they want to just track for them. They're not necessarily diagnostic because we're not seeing all components of sleep like in that PSG, but they're going to be good for tracking just your own biometrics over time. So we like the watch pat. This one, it has a wrist sensor, it has an oxygen saturation on the finger, and then it also has a chest sensor. And so it's looking at, again, those different parameters like your oxygenation, your heart rate. I think that one also is looking at your sleep position. Sleep image is similar. A pulse ox is just, again, it's one of those things that you put on your finger when you go to the doctor and they're looking at your pulse, but they're also looking at the oxygenation of your red blood cells. So it's telling us how many oxygen molecules are actually being carried in the red blood cells. And we care about that because it's telling us how oxygenated your blood is. So again, like Dr. Tarkini and I were saying before, we want it to be close to the same oxygenation that you're getting throughout the day, which is about 96 to 100% oxygenation. The Aura Ring and the Garmin, those are the new fancy ones. I have mine on. That one connects to an app. It uses Bluetooth, and it's going to be it's going to give you a sleep score, and it's looking at how many hours total you got of sleep. It's looking at how many hours you got in REM or in deep sleep, and it can then score based off of that. And it also takes into account like your HRV and your readiness. It does, I believe, look at your oxygenation as well, but probably not as accurate as the ones that go on the finger, or the other sensors that we discussed, like the watch pad. The nice thing about the Oura Ring and the Garmin, though, is that we're looking at a trend. So you're looking at a score that they're creating off different data points, and we're not trying to look at that as just that one score that we need to get to 100, but more as a trend. So it's nice for patients to try out different techniques to their sleep hygiene or adding in a different supplement and then see how their sleep score is affected by that. Again, it's not perfect and it's going to be based on different parameters, and it's all going to be based on how you interpret those results. So again, it's looking at the trend. So take everything with a grain of salt is what I'm trying to say here with that. And then lastly, just to reiterate, the nighttime oxygenation is very important. So number one thing we want to do is rule in or out that sleep apnea.
Okay, our favorite supplements. And before we go into this, we would be remiss if we didn't say, please always check with your doctor or healthcare provider before adding in any new supplements. The reason is that supplements can interact with other things that you're taking, like medications or even other supplements or herbs. And so it's just always good to make sure that you're in the clear before starting any of these things, especially when they affect sleep, because as we know, sleep affects so many different aspects of our life. But the first supplement that is very common, you'll hear talked about in all the sleep circles, is melatonin. And that's because melatonin is that chemical that actually is responsible for regulating our sleep-wake cycle, our circadian rhythm, as you've heard us mention a couple times. So in the day, when you wake up and your eyes are exposed to morning sunlight, your body produces serotonin, which helps us have energy and feel really good and robust for our day. And then in the evening, that lack of sunlight helps our body take that serotonin and convert it into melatonin. And melatonin is what we associate with helping us fall asleep. So this can be really helpful if you're someone who travels a lot and you have a lot of jet lag, or you're kind of jumping time zones, or if you do shift work, because oftentimes our circadian rhythm can get a little bit out of whack when that happens. The next supplement that we have here is magnesium. So magnesium, our beloved mineral, it's utilized in over 300 different enzymatic processes in the body. And actually, there's many different forms of magnesium. If you've ever worked with any of us, you'll hear us talk about how we like to use specific forms of magnesium for specific areas of your body. But largely, magnesium is a relaxing mineral. So it helps us kind of calm down in terms of our heart, our mind, our muscles. And so for that reason, because it's so good at relaxing, it's really nice to have in the evening time. And I typically think of magnesium as helping us sleep through the night. So rather than sleep onset like melatonin, this is helping us stay asleep throughout the night. And then also valerian. So sometimes you'll actually see a couple of these compounds actually together in the same product. And so usually when you see like an herbal sleep support, you'll notice valerian is in there. Valerian root is an herbal medicine that's known for its ability to help kind of calm us down. It's a sedative. It's what's known as a nervine, which means that it has ability to help our nervous system. So it kind of helps us tone down that stimulated, anxious quality so that we're able to move into the parasympathetic rest and digest state that Dr. Husner has been talking about.
I love L-theanine, so I'm glad that I get to pick up here. I take this sometimes as a supplement, but also sometimes, fun fact, I like to put this in my coffee. So this is a component that's naturally found in green tea. It's very calming. That's why when you drink green tea, when you drink matcha, you don't get so jittery. But with coffee, it doesn't have that. So I like to always just make that little connection there. And then, of course, you can take it at night to also get that calming um, sedative effect of it. The GABA we've talked about before, this is our calming neurotransmitter. I love this as well. You can take it as a supplement. We talked about before how progesterone can increase GABA. So optimizing hormones, especially in postmenopausal women, we're mostly going to be focusing on progesterone there for sleep. Since progesterone itself doesn't have a sedative effect, it's more of increasing that GABA. And then going back up to phosphatidylserine, this it helps with stress because what it's doing is it's helping to metabolize cortisol better. So break down cortisol throughout the night when we don't want those spikes. So going back to the circadian rhythm and those people who might have cortisol increasing throughout the night or earlier than it should be into the night versus in the morning, this is a really wonderful nutrient to help break that down and clear that so that way they can restore a normal circadian rhythm. But again, we always want to check with your doctor, healthcare provider before adding in any new supplements. And
So
that's it.
here's our summary slide. Quality sleep is really foundational to all aspects of your health. Your nervous system, your immune system, your hormone system, your metabolic, your blood sugar, and even your ability to repair muscles. And so if you're someone who does a lot of activity during the day, that's when your body helps kind of clear that lactic acid and things like that that can build up. And we do see, because sleep is so foundational to so many aspects of our health, Alzheimer's disease and cognitive decline or dementia are associated with poor sleep quality and duration. And this is a bidirectional relationship. So when you get less sleep, it certainly, I know that when I get one night of less than 8 hours of sleep, I can feel it. And so it's a bit of a bidirectional relationship there in that they sort of beget one another. Best practices, prevention is always key. So we love to regulate your circadian rhythm with stress management, getting morning sun exposure, and then always addressing the rest of your body and any underlying imbalance, because that's, of course, going to help sleep fall right into place. And then getting any airway, sleep apnea or reduced oxygenation in check, because that's huge.
I think I froze for a moment. I'm sorry. Um, okay. Does anyone have any questions? Let me check the Q&A. What time of the day do you recommend taking the PS? Okay, so phosphatidylserine, we like to say around 30 minutes prior to sleep. So similar to when you take like a melatonin or magnesium.
We have another question here. What is our #1 recommended supplement? That's the $1,000,000 question, right?
What's the one pill?
You know, as a true naturopathic doctor, I have to say I don't have one recommended supplement, because it totally depends on what's going on with the individual, right? And why they're not sleeping. For instance, someone might feel tired and wired, in which case it might be that there's too much cortisol or not enough cortisol during the day. Someone else might be having too much light exposure in the bedroom, like LED lights from like an alarm clock or any plug-in device. And so if that's the case, then I always tell people they can duct tape over those devices or invest in an eye mask or something like that. So it's hard to say one supplement. I don't know, Dr. Huesner, do you have a #1 supplement?
I recommend phosphatidylserine a lot. We just got a question how much phosphatidylserine. It's around, is it 1,000 milligrams? I can't remember if it's 100 or 1,000. I'm trying to imagine the bottle. I can quickly look that up. But can you look that up actually for me? Thank you. Uh, I often am recommending the phosphatidylserine because a lot of people are distressed and I can tell, have cortisol dysregulation. And we're often testing cortisol, especially morning cortisol. For some patients, we're actually doing a 4-point cortisol throughout the day where we can look at the trend of it. So that's typically one of the more common ones I'm recommending. But like Dr. Tarkini was saying, again, it depends on the person, depends on the cause. If this is someone who's a night shift worker, I might be trying to get them to take some melatonin to get that circadian rhythm back in check. If they have a lot of like muscle aches, or if they are a woman with heavy menstrual periods and cramping, then I'm going to try to get them on more magnesium. So I would say first phosphatidylserine just because everyone's stressed. And then from there, just depending on what else is going on.
And you are right, Dr. H. It is 1,000 milligrams. So 1 gram is the
Okay.
dose, 1 cap of the phosphatidylserine. Yeah.
Thank you. Thank you.
Good questions, guys. Anything else
Yeah.
in mind?
Nothing in the chat. We are going to have this recording sent out to everyone via email, so just be on the lookout for that. If you want to rewatch any of it, that'll be sent out tomorrow. Okay.
Righty.
Oh.
Oh. What is
So exactly what is the Garmin? Sorry, you can go, Dr. Turkini.
Oh, Garmin. So I don't know, maybe I'm dating myself. The Garmin used to be that directional navigation assistance, right?
A
Um,
GPS.
yeah, the GPS. So now they have iterations where it's like a wearable device that tracks your activity. And just like the Aura Ring, it can track your sleep. So it tells you if you're moving throughout the night or if it can detect that you're waking up. So it kind of gives you just like the Aura Ring, it gives you a kind of like a readout of how much time you're in deep sleep versus REM sleep, etc.
We got another question about we spoke a lot about postmenopausal females and what about andropausal males with insomnia? So that's a great question. If you go back, when we do talk about hormones, testosterone is one of the hormones that can affect sleep as well. So looking at testosterone levels, sometimes suboptimal testosterone, but there's also could be some other things going on here, blood sugar, cortisol, and everything. So we want to do a full workup, but definitely looking at the male types of hormones. DHEA is also another one that's produced from the adrenal glands, and it's an androgen, so it is a male pattern hormone. Sometimes that can also be extremely low as we get older, and adding a little bit of DHEA is good for mood. It helps to increase energy, libido, and then with sleep at night.
We have a lot of receptors for hormones in our brain. So
Yeah.
it's really important to make sure that your hormones are optimized, I would say, throughout your whole life.
Okay, we'll give it another minute or so. See if anyone can come up with some questions. But I do want to thank everyone for coming tonight and for supporting us, and then also just being interested in sleep and brain health. Okay, Dr. Tarkini, do you have any closing remarks?
No, I would just reiterate what Dr. Husner said. Thank you all for being here with us and listening to us talk about how much we love sleep and support you in sleeping. Maybe you can even try out one of these techniques tonight and let us know how it goes. And stay tuned, because if you guys have any also thoughts about future things that we can discuss, we would love to talk about them with you. So we're here for you, and I hope you get an amazing night's sleep.
Thank you all.